Does your plan also include any kind of job retraining or any kind of transition for the workforce that will be let go? I mean, that seems to be a big, it's a big hole to fill.
It certainly will, but I want to make clear that most of the highest paid employees there would be, at least if you look at other decommissioning challenges, would be the ones who would lose their jobs. And those happen to be highly trained nuclear engineers who are in great demand around the country, which is one reason that one of Energy Louisiana's challenges running that plan is it's tough to have any longevity in our employees there. We have lots of options around the country. So let's remember that the most likely to lose their jobs, or many of them, are in extraordinarily high demand around the country.
Who should have been working on this plan?
The state of Vermont, the utilities.
The legislature, the past governors? I mean, who should have been working on this?
I think it does us no good to look backwards. I think the question is, how do we in 16 months do a good job of planning for the closure of a plant that we should have been planning for the last 40 years? And I'm not suggesting that it was irresponsible to plan to keep it running. Of course it wasn't. That was an option. But I find it a bit surprising that I'm standing here without a plan for the obvious other option, which was that it actually be closed down on the date that it was designed to be closed down.
And a different owner doesn't really make any difference at this point if a new owner was to come by.
You know, with much regret to my youngest daughter, I stopped believing in the tooth fairy long before some others. And I'm not going to spend a lot of time speculating on things that I believe will never happen.
Could you envision a new power plant in this, a new baseload generation plant of some kind in the state, in your plan?
The energy plan is another really important part of this puzzle. Frankly, I've asked Commissioner Miller to bring the team together and develop a comprehensive energy plan as quickly as possible because, again, we don't have one right now that's acceptable. Having said that, for that reason, we cannot turn to you and say, Vermont needs to build generation. And if we need to build generation, we need to build this amount and in this form. So again, I would argue that we haven't done our work. We're going to get that work done, but to suggest that we should build a generating plant when we have no overall plan to get cheap, reliable rates to Vermonters would be irresponsible on my part.
But could a plant be part of that plan? We've already articulated the desire to get natural gas to Addison County.
Sure.
To expand that capacity. Absolutely.
The possibility of building generation in Vermont is going to make sense. It could well make sense. Clearly, renewable generation makes sense. The misconception is among Vermonters that we could replace that plant with another plant. And the problem with that is if you made the judgment that you wanted to build power generation, that would be an ideal place to build it because the transmission lines are in place. There's a huge infrastructure investment that's saved. But you have to bear in mind that under the best scenario, it's going to take you 16 years to take it away. There's no land on that site where you can build another generator. And you want to wait 16 years.
Have you decided yet whether or not you're going to reappoint Jim Bolts as the Public Service Board Chairman? His term is up this month.
No,
or February, I should say.
His term is up, and we've made no judgment.
Speaking of healthcare for just a second, there's some people in this building who think that some of your proposals that you laid out on Tuesday afternoon are really going to exacerbate the cost shift in healthcare. You're lowering the reimbursement rates for all those folks in Catamount by shifting them to VHAP. That's a dramatic change for healthcare providers. You're increasing taxes on hospitals, nursing homes, dentists, managed care organizations. Why won't these measures make the cost shift even worse? The money has to come from somewhere. Why won't it come from private insurance policies?
You know, there's no question that I'm not doing anything to help the cost shift. And as I've said many times, if we stick with the current system that we have, we will bankrupt ourselves and we will continue to have a system of healthcare where rural providers are harder and harder to find, where costs escalate, and where we continue to have a healthcare system that's not sustainable. I plead guilty to my contribution, although it's small, to the overall problem. That's why it's so important that we move to a single-payer healthcare plan as quickly as we can.
But is it fair to ask people who currently have private health insurance policies who have seen dramatic increases in the last few years, your proposals are gonna make those worse?
Well, I actually would argue with that. Let's remember, let's look at the big picture. We have 120, 130,000 lives under VHAP. We have 12,000 lives under CAPA. I believe my numbers are correct. We are moving the 12,000 lives in Catamount into VHAP. What that means is that their copay will go from $500 to $1,200 a year, but they will have no deductibles, which is what currently happens in the Catamount plan. So I don't think it's going to cost the consumers appreciably anything. It's going to save money for the state because we'll be reimbursing for those 12,000 lives at the same rate that we reimburse for the 130,000.
What about the health, what about the tax on the hospitals, the tax on dentists,
Well,
the tax on
sure.
all those people?
As you know, those particular structures were put in place to draw down maximum federal dollars, and that's what my plan does as well. So we are maximizing federal dollars. Listen, I do not pretend that my budget is good news. I've been warning you and Vermonters since the day I got elected that cutting $176 million or dealing with $176 million shortfall is a huge challenge. If anyone has better ideas that are sustainable on an ongoing basis, I am all ears. But I would suggest that when you actually pour through the numbers, the choices that we made in that budget balance the promises that have been made by state government with the ability of taxpayers in Vermont to pay the bill. And that is long overdue.
I just want to be clear, are you suggesting that healthcare providers and consumers in the short term need to experience a little more pain in order to get to the greater goal?
No, I'm suggesting that the current system is broken and it's going to take a true, comprehensive overhaul of our healthcare system to fix it. And as governor, I'm stuck with the same choices that other governors have made that have helped to contribute to the problem. I plead guilty. But you look at my options.
With moving Catamount into VHAP, does that send a signal that that experiment really didn't work?
Well, you know, I think we have to be fair to Catamount and to state government, to the folks who wrote that plan. You know, I wasn't here. It worked in the respect that if you're on Catamount, you have a beautiful benefits package. You pay very little to have that benefits package, and there isn't a Vermonter that wouldn't like to have the same plan. The failure of Catamount is no more significant than the failure of every single healthcare reform effort, every single healthcare plan that's been passed by any state legislature and any federal plan in the country, which is that no one has figured out how to contain costs. So our challenge in Vermont, it's an ambitious one, is to pass the first system in America that contains cost without reducing healthcare quality. And I'm convinced we can do it. So to say Catamount's, is it a failure? Well, sure, it's a failure in containing cost. It's a promise that can't be kept unless taxpayers find endless money somewhere that we don't think they're going to find it. But the stark reality is our healthcare system is broken. When you're spending $1 million a day in this little state, more than you were the day before, that's broken. When I go out and talk to Vermonters, which I do every day, whether it's business people or families struggling to pay increased premiums or premiums at all, they say to me, we get it. We know we're paying more and more for less and less coverage. We have to try and fix it. And what we're saying is yes. We're going to try to do what others haven't done. We're going to try to fix it. And that's about cost containment. It isn't about access. Catamount was about access, and that was a mistake.
There's a bill to allow for early educators to unionize. Are you back in that?
You know, I support the effort to bring them to the table. They have, for years, received inadequate pay for extraordinarily important work. So the answer is yes, I support their effort to come to the table.
Can you sign that, baby?
Well, let me see what's in it first, but I definitely support the concept.
You know, a number of times you talked about, and you did it in your budget speech, you talked about, I will oppose any broad-based tax increases. Very clear on broad-based tax increases. As you look at the non-broad-based tax increases, are there some opportunities there to raise revenue to offset some of the difficult budget cuts that you proposed?
Not that I've seen.
Then I'm just wondering, I'm curious why you use the phrase broad-based taxes. Why don't you just say all taxes, any kind, off the table?
Well, I thought I did.
So your use of broad-based is.
What I mean by broad-based taxes is, listen, you know, one has to choose their words carefully as governor, more carefully than I've been used to. So I'm gonna try my best. When we talk about a tax or a assessment on nuclear storage in Vermont, we gotta get that done. When we talk about the kind of assessments that I propose to draw down federal dollars, you know, we gotta get that done too, because otherwise we have to make more draconian cuts to the people that need us. So, you know, I'm a little careful to choose your words. I'm choosing mine for a reason. There are gonna be small areas where we're gonna find revenue opportunities as I propose in my budget. But let me be clear, Vermont's biggest problem is not that our income taxes are not high enough. They're too high. Our problem is not that our sales tax isn't high enough. It's too high. Our problem isn't that the rooms and meals tax isn't high enough. It's too high. I don't know what else I can say.
Well, I guess what I'm getting at is that some lawmakers are looking at soda tax, candy tax, as a way to help offset, you know, the 5% cut in mental health programs that you proposed. So I guess what I'm trying to get a sense of is, are you open to the possibility of other splinter taxes like that to be imposed in order to offset some of the most difficult cuts?
No,
Why not?
because Vermonters are paying enough taxes. Our job is to bring Vermont's spending in line with the ability of taxpayers to pay the bill. And I know that a lot of folks in the building think that we haven't found that point yet. When I go out to talk to Vermonters, they tell me they're paying plenty of taxes, and they want a governor who's going to stand up for them and make the tough cuts that are necessary to match our spending dreams with the ability of Vermonters to afford those dreams. And that's the budget that I presented.
Not to help folks. Folks have been saying that, you know, they've been taking tough cuts for the past 3 years, and a fourth year, you know, might impact some of the progress you're trying to make in corrections and other places by putting more people potentially at risk for support services in the community. What is your administration doing to work with them and trying to help them find ways to maybe act more creatively?
Well, both Secretary Racine and I have committed to working with them to mitigate the pain as much as we possibly can. I think an example of mitigating that pain is in the priority that I laid out in the budget, where we put together an ambitious first step in our goal to win the war on recidivism in our corrections population. I committed to $1 million new to be expended to ensure that we put the mental health services, the drug and alcohol counseling, the education and housing in the communities to ensure that we win the war on recidivism. So there are going to be lots of areas that we're continuing to expand prevention. At the same time, in terms of the mental health budget, we must be clear, I got to go where the money is. People keep saying, well, how can you go after vulnerable people? I'm like, you know, state government does three things. We build roads and bridges and rails so we can get folks around. We build prisons so that we can lock up people that we don't want around. And we take care of people that need us. I haven't got a governor's mansion to sell. I can't sell the state jet. I would. I can't, you know, sell the state yacht that we use on Lake Champlain. I would. I mean, that's what we do. We take care of people that need us. So I cannot propose a budget that takes on the tough choices that we have to make without having some effect. Now, mental health, there's state and federal dollars. We're expending about $200 million a year to our mental health providers to deliver services for Vermonters. Over the last 5 years, that's grown by $35 million. So, you know, we got to go where the money is, and those are the tough choices we have to make together.
Excuse me, just have to cut this off. The governor has to go to the farm show.
Going to the
Speaking.
farm, you're all ready.